Many people don't feel comfortable working with data and don't even know where they should start in the process or how they can build capacity in this area. We asked First Nations health leaders what advice they would give to those wanting to use data and indicators more effectively.
Information from all sources can be relevant and what we're trying to develop. We also need to look at data and sources, mainly community, yes. However, all sources that are available to us will paint a much more clear and relevant story. We have individuals who have mostly lived traditional lives and who carry many of the traditions with them. We also have many who have little to no experience even in their own culture and language. We need to balance those experiences and try to find the most relevant ways to collect the data that can paint a better picture for everyone. We also understand why data is important for us to have available for funders. We understand the importance of being able to leverage this information in order to paint a clear picture.
Reclaiming our data sovereignty, it's a new concept because before it was never taken from us. So we didn't have to reclaim something that was rightfully ours. Where now it's been, one, taken from us, two, given back to us without what we lost along the way, and three, it's almost like on this definition that we've lost sight of, or we don't understand it, or it doesn't translate into our ways. And so even having like the capacity to work with groups such as this to say, like, Indigenous data collection needs to be rooted within all of our ways, needs to align with our own ways of knowing, needs to be resourced equitably, and needs to be of the direction of your distinct populations. And so having that type of capacity over influence, I think, would be really awesome.
You may also want to reach out to, your regional tribal or organizations, FINIB, even AFN, and all those areas that they have some expertise. Not always just in collecting, but more so for analyzing the data, because that's something that we lack in our communities. And if there's some advice I'd give communities is don't wait till you get super funding to start collecting data. It's important. You can do that on your own. You don't have to wait for super funding to do it. Identify some key people, give them some tools, make sure that these people are, trustworthy to the community, and you'll have all the opportunities to get data.
Some advice that I would give to First Nations communities that are starting out in health research would be to not be intimidated by the terminology, the data analysis procedures, all of the statistical methods that are applied. I'd say start slowly. There's so many resources available online. There's other communities you can learn from their best practices and research that they've done. Look for trusted partners and other researchers. So if you've heard of another researcher that's done good research on this particular topic and that's of interest to you, and find out, engage with them, access resources online, reach out to organizations like FNIGC, FNHMA that have developed really good tools and frameworks for doing health research.
Be excited about doing this because it may seem complex, it may seem burdensome and whatnot, but once you've made a commitment to do research and data, you'll be surprised how many tools, how many organizations out there exist to give you a hand and help you along the way and develop some strategies in regards to collecting data and what type of data would be good and is a good start for your community. So making a commitment is important. Identifying perhaps key people in your organization who would be a good resource to spearhead certain that department or that program. The data, not everybody's into it. We understand that, but there's some IT folks I know and in our community, and that's how we did it. And that person now is our data guru. And they're the go-to person from health and even from band council. So when they need information, they have it. And it's amazing how often they'll call upon you because we have developed the expertise. when somebody from housing wants to put in a proposal and wants to know how many people per household, what's the demographics, the youth, the elders, and whatnot. And when you have all that information, it gives you power. It gives you decision-making, strategies. So be committed. Don't be shy to reach out for the proper resources to help you along the way. There's many tools out there. In the beginning, we had the quiz, community workload increase system. We have our morbidity reports in our health centers. Take a look at them. It's a good start that tells you what's going on in the community. Don't be shy to talk to your staff. Get the pulse from the people, because interpretation is another story.
So I think my advice for maybe new health directors or new program managers who are exploring the use of data but may not feel confident would be to think about what you already know. What were some of your teachings that you already received? So how do you apply those into your day-to-day life? And then I think that promotes this area of authenticity. My target population is not the governments. My target population is not, all of these programs that develop it. My target population are those at home who are not privileged to sit in these seats that we sit in, who are not privileged to meet with the people that we're able to meet with, and to take that with you and say, like, wow, I have such a privileged position to make change. And that is something that I will not walk with lightly. I'll make sure that everything I do reflects the needs of having a healthy and well community. We may not be there yet, but if I continue to go down this path with heart, with empathy, with compassion, great things will come.